Welcome to a Gerontological Society of America Momentum discussion podcast, where we delve into topics that are generating great excitement and advancement in aging.
Welcome to today's podcast, Steps to Increasing Adult Vaccination. My name is Karen Tracy, and I'm the Vice President for Strategic Alliances at the Gerontological Society of America, or GSA. And I'm pleased to serve as the host for today's podcast. GSA is the only multidisciplinary professional membership organization that represents experts who study all facets of aging. I am delighted to be here with Barb Resnick, Distinguished University Professor at the University of Maryland, and Julian Ritchie, Vice President, Head of Public Affairs and Patient Advocacy, U.S. Vaccines at Sanofi. Barb and Julian, I've known you for many years, and I'm delighted we are here today. Barb, you're a longtime member of GSA and a former GSA president. You have worked with GSA on addressing low adult immunization rates for over a decade, and now are the American Nurses Association representative to the Advisory Committee on Immunization Practices, or ACIP. And Julian, you and Sanofi have supported GSA for over a decade in our efforts to raise adult vaccination rates. Through your support, we have produced numerous programs and publications, including 2 well-utilized publications charting a path to increase immunization rates in the post-acute and long-term care setting, and immunosenescence implications for patient care. GSA launched our National Adult Vaccination Program to stimulate an increase in adult vaccination rates. Our program aims to support diverse interdisciplinary teams to increase reverence for vaccines among older adults. We believe that by better understanding the entire environment in which an older adult lives, we can enhance our vaccine rates. And in addition to addressing the vaccine-preventable disease, we also need to speak to the other health issues an older adult is addressing. We need to discuss the financial impact of illness on the older adult, their family care providers, and coworkers, and we need to address the societal benefits of a society that is immunized. We call this the concentric value of vaccination. Julian and Barb, let's get started with addressing how, in 2024, we might increase older adult vaccination rates. Let's start with my first question to you, Barb. What collaborative efforts can healthcare teams implement to champion adult vaccinations, transcending individual roles and responsibilities?
I think actually with all care we provide, particularly to older adults, but all adults in general, it takes a team. And what's really exciting about immunizations is, number one, we have a forever increasing opportunity and to get immunized and to get protected. And we also have an increase in some of the scope of practice things that different providers can do. I'll just throw out an example. Pharmacists in just about all states now can immunize, and we're looking at other opportunities. So there's many ways that a team can help make this happen. And we tend to think that providers are the people that really need to first raise discussions about immunizations for adults and make sure they're thinking about it and having it. But sometimes we can take what I call the PACE model, because in PACE programs, which are programs for care for older adults in the community, but in those programs, the person who's best suited to help change the behavior in the patient is sometimes the one who talks about it. So there's many ways individuals within healthcare teams can help improve immunization rates and really make it happen for adults and older adults.
And Julian, in 2023, we saw a dip in vaccinations among older adults. In May, this past year, CDC reported that 22.5% of adults had received the 23-24 COVID vaccine since September 2023. They also reported that only 24.4% of adults 60 and older had received an RSV vaccine, and 6.3 million fewer flu vaccine doses were administered to adults 18 and older in retail pharmacies and in physicians' offices compared to the same time in prior year. Less than half of the adults got their flu shot last year. In 2024, where complacency and confusion can threaten adult vaccination rates, how can we ignite urgency and awareness among both the public and healthcare providers?
Karen, you bring up a number of interesting points here. And unfortunately, the indicators have been showing us these decreasing trends. I think what we're seeing is it's most important to look at why these rates are where they could be. And unfortunately, the best conclusion we could reach is it's not a singular reason. There's a lot of different things contributing to this. It's a complex mix of factors that include a complacency, over messaging, if you will, on vaccines recently and after the pandemic, and simply confusion. As we have more vaccines that provide more possibilities for protection than ever before, but this requires more scheduling and more engagement from patients and that provider team that Barb mentioned to be sure that folks get all of the immunizations that they can and should have in order to provide the best protection against disease. It's becoming a more urgent issue in older adults because that age segment continues to grow with our aging population. And the value of prevention as older adults remains just as important on an individual level, but the sheer number of the older individuals who need to get immunized is another reason to rethink and improve our immunization efforts. Unfortunately, this comes at a time in society where we have more challenges than ever before with issues like distrust in science and questioning of medical authority. Providers of all stripes know that patients now ask more questions. So part of the meeting the challenge is to engage patients in a discussion that dignifies their questions and yet helps them reframe that understanding and their thinking as to why immunization is so important for them and for those around them. The public health goal of immunization is to prevent serious disease, hospitalization, and death, and to preserve patient independence. This can seem counterintuitive because we like to think that when we get immunized against something, we won't get that illness at all. In many cases, we don't. But with respiratory illnesses, that's unfortunately not always the case. So many illnesses have flu-like symptoms that it's easy for people to perceive that the vaccine isn't doing its job. These are a few of the examples of the issues that flu, for example, faces, and they also illustrate the importance of having local trusted voices in the provider and in that team that Barb mentioned. It's essential to help patients sort through the factors that are most important and get patients more confident and ultimately get them immunized.
So we're all facing a lot of information coming at us all the time. Julian, how might we break through vaccine misinformation and hesitancy?
A couple of things that we see through experience and feedback that work are simply being transparent, sharing the development process for a vaccine, the rigorous attention to safety and monitoring that are always in place, and explaining what they might experience after immunization so that there's not a confusion or an undue concern on a patient's part. As all of this is about their immune system ramping up and learning how to protect against the disease they're being immunized against, helping them understand that through that transparent conversation. Listen to their concerns and address them directly. As I mentioned before, validating and dignifying the questions of the patient. Questions aren't a bad thing. And so it's important because that means that the patient is engaging in their own healthcare journey. How can we help them do that? Obviously, we can't spend an inordinate amount of time with the patients, helping them do that, giving them resources. And that's something we try to do is provide resources that can help educate them so that they can ask the most important questions when they come in. And I think the single most important thing is to make a confident recommendation to assure the patient is receiving a vaccine that will be their decision, but at the same time, have a clear understanding that the medical advice of their provider that they're standing in front of is to get that vaccination. And this is made most clear when the providers themselves are immunized and can reference that I follow my own advice. I get immunized. So those are a couple of the things that stand out that I think can help cut through some of the confusion.
And Barb, I'm sure you've had experience where you've had to motivate patients and help bridge that gap between their beliefs and evidence-based practice. Can you share some of your experiences?
And so a big part of the work I do is, in fact, motivating people to get immunized. And I think we raised an important point. First of all, people don't act on what they know, but what they believe. While we can provide the information and it's important to give some of the numbers, we know there's data, quote unquote, out there and facts, quote unquote, out there that may or may not be true, but it's what the person believes. So it is critically important to find that out. And my favorite question when I'm trying to motivate anyone to do anything is always, what stops you from getting immunized? Because we may be assuming what it is. It might be access. I can't get a ride to anywhere where I can get immunized. No problem. I got a house calls program. I'll come out and get it to you. Or it might be, I'm really afraid. I'm afraid of needles. Well, I'll hold your hand or whatever. But it's finding out what that thing is. Every morning I ask my husband what stops him from exercising. And there's a reason. He knows it's good. People may know it's good, but something is stopping them. My favorite, of course, is always time, which is always, okay, really? Do you have time to have the flu or COVID in a few weeks? Probably not. So it's finding that out and seeing what you can do to address those concerns. All we can do is try. The other really big part is to make sure we never give up trying. And this is the biggest problem with providers. Not only do we know that they're not having the conversation once, but we also know that what happens is if somebody refuses to get immunized, it's like tattooed on their chest and nobody ever asks again. And it's critically important to keep asking, because if I keep asking you at every visit or talking with you about immunizations, what it shows is, my gosh, this must be important enough for her to take her time and energy, and I can be pretty obnoxious, to keep discussing this. And so those really are the three most important motivational tricks of the trade. There's other things around, some altruism and reasons why they should get immunized. Some people care, some don't. Keeping your family safe, keeping your friends safe is certainly important to some, but it's really finding out what's stopping them.
Yeah.
Barb, can I just echo your point about the importance of that continued conversation? One of the challenges we see is that this has become tough for providers. And so providers have stopped having the conversation. And in some cases, actually feel like they don't need to immunize anymore. It can be handled somewhere else in a pharmacy or other. The sanctity of that relationship with the patient and helping them get from your point about what they believe to what they know, that is just so important. And I think it can't be emphasized too much that the provider staying in the fight, if you will, in order to help there be clear messaging, clear information to address concerns, because people do change over time. And in some cases, if they are continued to be given information, educated on this, we see time and time again that they will actually change their position. And that might be the visit where they might get immunized.
And I would also add, it doesn't have to be a major time issue. It can be as simple as at the end of a visit saying, it's September 16th, you are due for your flu and COVID booster. And we're going to give it to you today, if that's an option, or here's a list of where you can go, or whatever it is, depending on your population. But it doesn't have to be a long conversation, and it can be incorporated into the entire, I could talk for the whole 15-minute visit or whatever it is. So I think it's really more for providers getting into the habit of this routine conversation that they're comfortable with. They have to believe in it as well.
A clear, confident recommendation. Absolutely.
Exactly.
I love that we're having this conversation, Julian and Barb. It's really critical. And Julian, there's a lot going on with vaccinations. It's a pretty crowded landscape these days, and we're very thankful for it. But how can we implement some flexibility in our vaccination schedules without compromising patient adherence or overall acceptance of vaccination?
But you're certainly right. We're at a point where we're lucky enough to have multiple preventative products, but we do need to put a little time into thinking about how we make sure we implement it fully. It doesn't do any good if it stays in the vial. A vaccine only is valuable when it becomes a vaccination. So it's important to remember that not every vaccine needs to be given at one visit. There is time to separate the doses to make the patient experience more positive and less stressful due to that confusion factor. There's a lot of tools that are becoming available that are starting to educate more on this because of the changing adult landscape and the additional products that are available there and the schedule opportunity to be able to focus. For example, flu vaccines are best given in the September, October timeframe to get protection on board, but they can be given anytime until the flu hits your area, which most frequently is February through March throughout most of the country. COVID can be given a little earlier or at the same visit. There's good data now that supports that. Again, based on epidemiology of the COVID disease, that can be given a little bit earlier in order to help space things out. RSV is a newer entrant, and it can be given year-round, and it's not recommended for an annual booster, so there's a little more flexibility there as well. Shingles and pneumo, flexible and can fit into the schedule at other visits because most of these patients do have multiple visits throughout the year. It's just that very often we think of immunization and respiratory season in the fall, and that's when all of a sudden we're focusing on all the immunizations. So a little bit more thought, a little bit more planning into a more full schedule and looking for some of these opportunities can increase our flexibility and make it a better process for everyone.
And Barb, I have one more question to ask you guys. And earlier in the podcast, I mentioned the lower rates of vaccines for flu and COVID and pneumonia. And we've also seen that some of the vaccinations that are in the providers' offices has also decreased. Can you talk a little bit about the whole vaccine neighborhood and the importance of a provider?
Yeah, I think I'm sitting here and reflecting on the fact the ideal with getting people immunized is to make it as easy as we possibly can. We know that I do a lot of work with staff in long-term care, and we have to be like, they have to walk by it because if they have to walk down the hall, it might not happen. It's too far to go. So the neighborhood, ideally, we want to make it a close neighborhood. But I think there's ways to think about there may be certain vaccines that we can provide in a provider's office because of insurance and many other factors, and it's easier to do, right? Or there may be some immunizations that it's easier for us to take to senior housing or home care or wherever the person lives. And then there's others where it may be easier to make the referral. And that's where it's really important to know the neighborhood that the patient lives in and what might be accessible down to how are they going to get there. And again, I tend to work with an older, frailer population. They can't walk to the pharmacy, even if it's down the block. Can't or won't, or maybe two different things. But it's really thinking through all of those barriers. But most important is whatever we can do to make it easy, fun, of course, but really bringing it to people. And I know myself, we've done an amazing job bringing immunizations, everything from COVID to shingles to RSV to senior housing. And it brings people down from their apartments. It doesn't bring them down depressed, brings them down from their apartments to get immunized because it's easy.
Building on that, while there's different places where people might get immunized, there's a number of different factors that go into that.
Mm-hmm.
if you agree, but I think what everybody can take away is that everyone has a role in the education and recommendation process.
Mm-hmm.
To your point, keeping that neighborhood small and tight and making sure that folks follow through and actually do what you recommend for them to do if they're going to go to the pharmacy instead of doing it in the office is part of the oversight there. But there's a critical role for all providers in making sure that the patient has a clear recommendation from them. And then the second step about where they get it has some more flexibility based on the cert.
Yeah.
Barb and Julian, this has been a wonderful podcast. We've heard about ways to stimulate our interdisciplinary team, instill a sense of urgency, how to motivate our patients, steps to address hesitancy and misinformation, and how to be flexible, and that all providers have a role in recommending a vaccine. I am so glad you're able to join us today, Julian and Barb. Your insights and observations are so incredibly important. And thank you also to those listening to this podcast. We hope you found it informative and enjoyable. This podcast received funding support from Sanofi. I encourage our listeners to check out other GSA Momentum Discussion podcasts and webinars in our library on geron.org. Thank you.
Check out GSA Enrich at gsaenrich.geron.org, which is your gateway to a library of engaging learning resources. Access toolkits, courses, webinars, and more podcasts, all tailored to support your interest and advancement in the field of aging.